The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hi, everyone. I'm Tony Urbanek, and welcome to the next episode of TMD Demystified. This morning, we're going to talk about a very important topic when it comes to treating TMD patients using the Urbanek device and protocol. I've touched on it before, but we're going to try to nail it down today and discuss it a little more in detail. Very important as aspect of treating the problem and getting the results, and that is to use the device itself and understand that the device is a tool to be used with a protocol, and that compliance from the patient and education is also extremely important to deliver to the patient by the doctor, by the network provider, for success of the device, and to limit the number of symptoms that the patient has as quickly as possible. So the first point is, I don't know how else to drive it home, but it's extremely important. And this is really misunderstood in a tremendous way. This thing is a tool. It's just a tool. Fits in the mouth. And there's so much misunderstanding about this. The patients think they're buying a widget, you know. I understand that. I understand the misunderstandings about that. That's why I'm trying to get rid of the misunderstandings. But certainly not a widget, and it has a certain set of properties to it. It does fit in the mouth, doesn't do anything inside the mouth. As you know, all this does is unload the joint to allow the inflammation to go away within the temporomandibular joint, which allows the symptoms to go away. But you have to use it as a tool. If you just use it any old way, you will not get the response that we know you can get. So just like I use it in talking to patients all the time, if you hold the screwdriver with the wrong end, you'll never get the screw to go to place. You don't know how to use the tool. So, and it's important that the patients and the doctors understand that this is a tool to use. And if you use it correctly, you'll get the response. So the first thing that I want to avoid, and we certainly try to avoid around here, is, you know, giving a patient this device as a tool without proper education. Now, we've tried to avoid that from the get-go as we develop the network of network providers that are in my office every day and get to listen to how I've developed this and use it. We have a package insert, which is not just to satisfy the FDA, but it is there for good reason by the FDA, so that all of the information regarding a patented device, or in some cases a drug or whatever, has a package insert which tells you everything you need to know about the device. So in this case, the Urbanek device says here, Urbanek device instructions for use. It's very simple. I wrote this myself several years ago now, and as is custom and is necessary, required by the FDA, a copy of this set of instructions is inserted with the delivery of every device and in our office, and instructions are given to every network provider that when the patient says that they want to do this and that impressions are taken before impressions are taken. Emphasis before impressions are taken. The patient is given the opportunity to read these instructions before you ever fulfill the impressions. Take the impressions, take their money, get impressions. Most of the patients do not want to read this before they take impressions, but they are given the opportunity that this is the package insert. These are what is necessary to do and know to use the device. So this is a very important document, extremely important document for many reasons. Biggest reason is the patients need to know all the details of what expected them to do so that they can get patient compliance, good results with good patient compliance. That's why this document was written. It really hasn't changed in, I think this document is probably, well, ever since we got the FDA approval. So this document is now like 4 years old. I have no reason to change this. So everything that's needed to know from a patient's point of view about using the device is on this document, and they're given the opportunity to read it before they actually take impressions, and they are asked by me personally and should be asked by every network provider when this device is delivered to read this set of device instructions completely, cover to cover, before they ever start using it when they take it home. And that is part of my instruction sequence, which I think I've given to you in details how I deliver this sequence on other podcasts. So as the concept that we have to use it as a tool, you have instructions for the tool. It's pretty simple. And then you just have to do it consistently. That's the other part, the consistent part of it. You can't skip anybody. The second reason this is important is for doctor's liability. I've been a maxillofacial surgeon now licensed as a maxillofacial surgeon since 1976. You figure out the number of years, a lot of years. And during that years, I performed thousands and thousands of maxillofacial operations, intraoral, extraoral, facial reconstructions. And I learned early, right from the get-go, that it's important that you have liability insurance and that you're always concerned about your professional liability when you start taking somebody's face apart and putting it back together. Well, this translates into using a very simple, very inobtrusive, is that a word? Unobtrusive device that you still have to know things that can happen with that. And super eruption of posterior teeth is not one of them as far as adults are concerned, using it correctly according to the protocol. But this set of instructions, package insert, actually is an extremely important component of covering you and your professional liability in using this device. So point is, you got to use it. Very simple. So that's what the patient needs to know. It's in writing. You can emphasize some of the things on here, which I do. When I deliver a Urbanek device to a patient, the instructions are pretty simple. I tell them, I hold a little container in my hand, and I say, so this is what you need to do. You need to keep it in 24/7, except when you eat. You can drink with it in your mouth. Coffee, tea, soup, hot fluids are fine, but when you go to chew, you got to take it out. After you eat, you brush your teeth. You brush your device with toothbrush, toothpaste only. Put it back in your mouth. Always keep it in a case when it's out of your mouth, 100% of the time, because people lose it, break it, let the dog chew it up. Always, because it's out of the case, even for a split second. Patients come in and say, it's only a split second when it's out of my mouth, and that's all it takes. We don't want them to lose it. We don't want to have to do it again. We don't want to have further charges on the service, and they will appreciate that. And so those are the simple instructions that are part of this. There are other more technical things that I really don't need to go into. It's all in the package insert. But the emphasis on this episode is that it's a tool, and talking about emphasizing to the patient and in your own mind as a network provider that it's just a tool. You have to really understand the protocol that goes with it. Again, the protocol is well covered in other episodes. And the last point I want to make, and it's going to be a rather short podcast because I don't want to belabor this too long, because these are extremely important points to make, but they're extremely simple. And I don't want to bore you with it, but I think the last point is talking about patient compliance. You can't expect good results if the patient can't follow instructions. You know that from whether you do surgery or whether you do periodontal surgery, extractions, crown and bridge. There's certain instructions you want to give a patient. It's important to have completion of that service successful, and that's called patient compliance. So frankly, if the patient reads this and complies with the simple instructions, they'll get the result. Now, from the doctor's point of view, I guess you could say you need a certain amount of doctor compliance, because again, you have to use it as a tool. Sometimes the tool needs to be modified a little bit. We talked about that certainly on prior episodes, and the fact that vertical dimension sometimes needs to be increased to decrease the loads on the temporomandibular joint further than automatically goes with 1.5 to 2 millimeters of separation. Sometimes you need 3 millimeters separation, increasing the vertical, decreasing the forces on the temporomandibular joint, which in turn decreases inflammation. And when that occurs, it's all about decreasing inflammation. But the point is that the doctor, the provider, again, needs to follow the instructions. So I guess we can call it doctor compliance. To just give this to someone as a widget and say, put it in your mouth, you're just kind of hoping for the best. And that isn't what we do. Hoping for the best is not what we do. We know that if you follow the protocol, if you use the instructions carefully as a provider, and you get good compliance from the patient, you'll get good results. I can't say we don't see any exceptions, but there are very, very few exceptions. Very few. I think that I can only count on one hand patients who have not done well with this that I couldn't figure out why. And I want to get astray on another topic, but the biggest thing that I've observed here recently, when I say recently, over the past year, and we'll talk about that on a future episode really quick, because I have it on the lineup to talk about, and that is patients who have a habit of protruding their mandible, either knowingly or unknowingly, usually to just fiddle with the device. Or a lady told me recently, well, I have a habit of just sticking out my tongue. Well, that's going to protrude your mandible, which is going to disocclude the condyle from the glenoid fossa, which is going to contribute to the inflammation, contribute to the damage within the joint. Different podcast, different time. But again, understanding that that's part of the compliance from the doctor is to understand that it's used as a tool, and you have to understand how the tool works. So simple. Sometimes it's so simple I just don't even think I need to explain it. But I find, talking to other doctors about this, that their level of what either they know or been told or know, or just have a total unknowingness of anything about the temporomandibular joint. This is so surprising to them that they have a hard time getting their arms around it. That's what I'm trying to simplify. TMD demystified. TMD demystified. It's not mystical at all. So you have patient compliance and doctor compliance on the point that this is a tool, and there's a protocol that goes with the tool, which is not just how often they come back, but it's what you do when they come back at any point in time to increase the probabilities that they will get good results. And it's a team effort between the patient and the doctor in this case. And most of the time it's unspoken. I don't go into it in a lot of detail with patients. And I don't really mention compliance per se. I don't use the word with the patient unless I find I'm not getting compliance, at which point I will use the word vigorously with the patient compliance. They understand. They know when they're not doing what they're asked to do. They know it's not right. It's not healthy for them to just take the device and not come back. We see that when the patient gets results and they won't come back. I mean, it's not infrequent that we'll deliver one of these and we might see the patient back at 3 weeks and they say 70% of the symptoms are gone and we never see them again. We can't bring them back. Well, we know why, because why go back to the doctor? I'm fixed. I don't need to go back to the doctor. And of course, we don't get the chance to follow them. We don't get the chance to put it in the chart to document it, which we'd love to do on everybody. But we know when we deliver one of these and they pay for it, and whether it be immediately or after just one appointment, they don't come back, we know what the problem is. They think they're fixed. We want to see them up to 80, 90, 85 to 100% of their symptoms resolved. That's our goal. And we meet it almost all the time, 85 to 100%, at which point we let them go. But we expect, and I hope you as a network provider expect, to get as good patient compliance as you can. Understand that, it is a tool, and you understand to use the tool. I use that phrase a lot with patients. I bring it out, I point to them, I said, this is a tool. It is not a widget. You have to use the tool correctly. Here are the instructions. They're written. Here's some verbal instructions that are also in the package insert. You use it as a tool correctly, you'll get the result. It goes for the doctor to understand the network provider, the provider of this service. If you use a tool correctly, understand the nuances of using the tool, and you have patient compliance along with it, you will consistently good results. All of our studies, the independent study shows that, and I want to emphasize that today. So I promised you a short episode today, a short video, and we'll leave it at that. I just want you to keep that in mind. It's an important feature to always emphasize in your own mind and to the patient that this device is a tool. You have to use it correctly. With that said, I encourage comments, I encourage criticism, I encourage communication with me and my staff. I can be reached at Tony@tmjservices.net. Our Director of Marketing and Education, Naomi, can be reached at Naomi@tmjservices.net. I look forward to hearing from anyone on any topic regarding TMD. And with that, I will end it as I am Tony Urbanek, and this is TMD Demystified. I look forward to our next episode.